Welcome to Now Let's Talk, the podcast with Vanessa Corwin and Kathleen Kahn, where we speak with our guests about the joys and challenges of life in today's world. Hello, I'm Vanessa Corwin. Kratom is a plant-based substance that is readily available in cannabis dispensaries, convenience stores, and online, and is legal in a number of states in the U.S. Yet, it is not approved by the FDA for any use. People take it for many reasons, some to get high. Many say it should be a controlled substance like heroin because it is addictive. In this episode, we'll explore Kratom from the clinical and personal perspectives. With us today is Dr. Tucker Woods, Associate Chair, Emergency Department, Staten Island University Hospital in New York City, and musician Timmy Cappello, who will share his journey with Kratom. Welcome, gentlemen. Thanks for joining us today. So, Doctor, let's start with you. First of all, what is Kratom? How do people ingest it, and how does it affect the brain and the body? And is it dependent at all on the amount of the substance that they ingest?
Sure. So first of all, thank you for having me. So Kratom, it's not a new drug. It's actually a plant product, and it's from a leafy tree that's actually a member of the coffee family, and it's native to Southeast Asia. It's cultivated elsewhere now, but its roots date back hundreds of years in Southeast Asia, where the native population, they used to chew it. They would chew a few leaves, or they would drink it as a tea. And in the Southeast Asian culture, it would be used to enhance stamina. It would be used to reduce fatigue. In some cases, it would be taken as an diarrhea medication or as a cough suppressant. But since the 2000s, especially around 2015, 2016, Kratom use in the United States has dramatically increased. One of the issues is the population's using it much differently. So when you study poison control data from Thailand versus poison control data from the United States, we're seeing issues that are not being seen in Southeast Asia, and part of that is the way they're packaging the product. And so, if you look at Kratom, the plant, it actually has 40 different active components. We call them alkaloids, and out of the 40, the one that's most prominent is something called metragenine, and about 66% of Kratom's active ingredients is the metragenine. About 2% is another active ingredient called 7-hydroxymetragenine or 7-OH, and it's highly, highly addictive. And so, unfortunately, we have, I would call them clandestine chemists, where they will concentrate the percentage of that active ingredient, the 7-hydroxymetragenine, and it becomes very addictive. They'll even extract exclusively that component and they'll sell it as an extract. And when it's sold as 7-OH or 7-hydroxymetragenine, a lot of folks refer to it as gas station heroin because you can become so addictive. And I believe around 2016 or so, the FDA proposed making it a scheduled drug, like a controlled substance. But there was strong pushback by lobbyist group and lawyers and scientists saying, this should not be a scheduled drug. So right now it's really unregulated. And so if I buy Tylenol at a drugstore, I know I'm getting Tylenol. But if I buy Kratom at a gas station, because it's unregulated, it's really buyer beware, because you really don't know what percentage is 7-hydroxymetragenine, what percentage is metragenine. And so you're seeing a lot of adverse effects. You're seeing intoxication. People are becoming addicted. When I've treated patients with Kratom addiction, the Kratom use usually goes up tenfold within just a few weeks. I specifically remember this one patient I had when he first started using Kratom. He would start off using about 7 capsules a day. But within
Is
just a
that a
matter,
lot?
7 capsules a day is no, I would say not a lot. But within just a matter of weeks, he would take 80 tablets a day. And I asked my patient, over what sort of period, like when you woke up in the morning, how quickly would you swallow those 80 tablets? And he said within 5 minutes, Dr. Woods. And that's because you develop the tolerance so quickly. And then when you stop it abruptly, you experience those withdrawal side effects.
Right.
So
So
I personally wish it would become regulated, because right now it's just buyer beware. You don't know what you're buying.
So, how does it compare, in your view, Dr. Woods, to opioids and other substances in terms of addiction and withdrawal?
It binds very highly to the brain's opioid receptor, but it doesn't activate it fully. You do see overdose deaths, but not in the numbers like you would fentanyl. You see the exact same profile. People will develop a withdrawal syndrome if they stop it abruptly. So when they do stop it, you'll see symptoms such as nausea, vomiting, diarrhea, insomnia, hot flashes, abdominal pain. And so I had a decent number of patients that came to me struggling from kratom addiction. And they said the withdrawal was terrible, terrible.
So, are there certain personality types or certain types of people that you see in your view that tend to try kratom and become addicted to it? Men more than women?
You see it more in men, like about 55, 56% of kratom users are men. We don't have good data, unfortunately, on kratom. Another problem is we don't pick it up on routine drug testing. In terms of reasons for use, some people are using it to self-treat for chronic pain. Some people are using it to self-treat for anxiety, depression. Some people are self-treating related to opioid misuse, including opioid withdrawal. So some individuals, if they've weaned themselves off of fentanyl or heroin or another opioid, they will transition to kratom. So that's generally the reason individuals use kratom.
Do you see a high percentage of relapse? Is there, do you know what percentage of patients succeed in getting off of kratom and how many might relapse?
So we don't actually have good data on it.
Mm.
There are not a lot of controlled or published studies on the questions you're asking. Everything is really more so from case reports and physicians speaking to other physicians,
Mm-hmm.
maybe attending a lecture or seminar, but we actually don't have good data on exact treatment. So what's funny is I have and it's not funny, but my addiction medicine textbook, my Bible, it's 1,850 pages. I have one page on kratom, and
Wow.
it's not even a full page. It's relatively new on the scene. It really took off in popularity, I would say, in 2016. I would say the majority of doctors don't even know what kratom is.
Hmm.
A lot of a high percentage of the population, like you said yourself prior to this podcast, didn't know what kratom was. But because it's relatively new to this scene, we don't. There is no best practice textbook. So I'm board certified in addiction medicine. So what a lot of individuals are doing with kratom use disorder, or KUD, they'll treat it the same way as you would with somebody who's addicted to fentanyl, somebody
Mm-hmm.
who's addicted to heroin. So, and it also depends on what the patient's goals are. Some patients will try abstinence, and then if they're, or a 12-step program trying abstinence, and if they're not successful, then they might end up seeing somebody like me. And then we have doctors have different tools in their toolbox in terms of medications to treat it. So a lot of addiction medicine physicians have had success using a drug called buprenorphine. Some individuals might know it as Suboxone. I would say very rarely would a doctor treat kratom addiction with methadone. But by and large, a lot of the addiction medicine physicians out there will treat it with buprenorphine in a lower dose than what's required generally for individuals who are
Hmm.
addicted to heroin or fentanyl.
Right.
Some doctors are also treating it with this opioid blocker called naltrexone. The brand name's Vivitrol. It's a monthly shot, or it can be a daily pill, but really the monthly shot is better. And so those are some of the medications for addiction treatment. That's what a lot of the addiction medicine physicians will use.
Sure. So that's how you treat kratom addiction in a clinical setting. So Timmy, now let's go over to you. Now let's tell us your story. When did you first start using kratom, and what made you start using it?
I have been diagnosed with an anxiety disorder. So I was taking, benzodiazepines, and I thought to myself, oh, maybe I could use a leaf. Maybe I could use what was thought of as an herb. Maybe it would be a better choice than I had heard about, Klonopin, which is what I was taking. So it seemed to help, but I think the way I could contribute most would be to just tell you what happened to me at my worst with kratom. And I would just, really overdo it. And, vomiting and still doing it more. And I actually,
Like even
I
with those symptoms, you kept using it.
exactly. It was very, very, kept thinking, oh, more would help. Maybe more would help. Maybe a little more would help. And I lost my car, just left it somewhere and didn't know where it was.
Wow.
I was so high, and I wound up spending about 3 days in the emergency room. I couldn't remember my name. I couldn't remember what year it was or what my address was. And although obviously it was the amount that I was using that just shut off my brain pretty much entirely, it was quite a shock. It was quite a scare. And that is what I would say was the worst, was just overdoing it and, going to see how much I could ingest. And, that was not very smart idea, obviously.
So Timmy, at what point did you realize that you were addicted to this stuff and that it you needed to withdraw from it?
Yeah. Well, before this all happened, I had been taking it for quite a while and not knowing any of the information that the doctor's been giving. I just thought to myself, maybe this is better than Xanax or Klonopin. Maybe this is a smarter move. And so I would try to keep it under control, and then would stop for a while, but then would always start up again. Yeah, I mean, the withdrawal was a little different. When I was in my 20s, I did have a heroin addiction. This was a little different. It certainly wasn't as violent a withdrawal, but, just covered in sweat and, shaking like a leaf. That's bad enough. That's pretty bad withdrawal, I would say. And so it has taken me a long time of stopping, starting, stopping, starting. I actually did go to a rehab center, and nobody knew what it was. There was no way to test for me to see if I had done it before I came in. I would say kratom, and also there's another substance called kava that's a similar, comes from a similar part of the world, and people a lot of times will mix them, which is what I did.
Oh,
So
you
I
think?
would say, yeah, I would mix them together, and they had slightly different. One was a little more of a stimulant, one was a little more of a sedative, and I thought, oh, this could be okay.
Hmm.
But over and over again, as the doctor said, I would just go more and more and more and more. And that
So,
was, that's my story with it. I mean,
so,
I could have really died because they said that I had acute kidney disease
and it was
just
from,
from,
it was
just from
from
having
kratom.
taken the amount of kratom that I took.
Wow.
And
S-
Timmy's story is not uncommon. A lot of people, just like Timmy, when they assume that because something's legal and it's marketed as like an herb, they assume that because it's legal, it must be safe. And unfortunately, that's a common story. And there's really right now there's zero regulation, and it does have me concerned.
I definitely want to tell my story, but I think listening to the doctor is the thing that's really helping me a lot.
Now, Timmy, you mentioned that the withdrawal from kratom was, to use your term, less violent than the withdrawal from heroin, but you did decide to do it cold turkey, right?
Yeah, I did find that it was very hard, even though it wasn't what heroin addiction was. Like I really knew that I had to stop heroin. I just, it. It's so violently horrible for you, and the reactions and frightening my family by the way I looked and behaved, and it was just so very obvious that you just couldn't do it and expect to have a life or have a long life anyway. Kratom is not quite that violent. And so I felt, I'll tell the story of a friend of mine. And this is not something I'm very proud of, but his son was a heroin addict and he kept going to prison. He was a teenager, and I said, well, maybe you could try this kratom stuff that maybe he could get off of
Mm.
heroin. And so he did, and I felt he finally died, not from kratom, but
Wow.
having gone back and tried heroin again. And
Oh,
it must have
wow.
had some fentanyl or something because he was dead in a matter of minutes.
Oh,
So I had said to my friend, geez, I am so sorry that I gave this advice to you. And uh, this is getting a little off topic, but he said, you know what? Honestly, the kratom gave me 6 months more with my son
wow.
because he didn't die. He didn't OD. When
Yeah.
he was taking it, he at least was around and we could talk.
Yeah.
Uh, so it's just like the doctor said. It just yeah. Who wouldn't want to use something natural when you're sort of addicted to benzodiazepines?
So let me ask you this. Now that you have kicked kratom, do you miss the high that you got from these drugs, from kratom or even heroin?
I never miss heroin. It was a long time ago. I mean,
Yeah, yeah. But what about
50
kratom?
years ago. Yes, I would say so.
Mhm.
It rears its head to say, oh, maybe I'll just do it once. Because it doesn't fit. When I stopped heroin, I also stopped smoking cigarettes. And I found that to be tougher because it didn't feel like something that was going to kill me tomorrow.
Mm,
And so I kind of feel like, oh, I'm going to say something that I hope the doctor will, set me straight on, and that is, it did cure my anxiety.
Well, we'll get the doctor's take on that, definitely. But I wanted to ask you, did it affect your work, your relationships?
Absolutely. My wife, she would say, "I know when you're doing kratom because your IQ gets cut in half. You can't remember nouns. Nouns are incredibly difficult to finish sentences with when you're on kratom."
Dr. Woods, again, let's go back to you. What's your take on Timmy's story? Is this kind of common? Do you see this a lot?
Yeah, his story is very common, and even the story of his friend who passed is common because a lot of individuals who are addicted to heroin or they're addicted to fentanyl, they don't know how to stop, and so some will transition to kratom as a form of harm reduction, to wean themselves off of heroin, wean themselves off of fentanyl. And so it's a common story. And then Timmy brought up a good point. If you've been off of heroin, say for, a year or 9 months, you no longer have that tolerance. And so if you then try to go back and use the same dose of heroin that you used to do, because your body no longer has that heroin tolerance, it can kill you instantly. And so that sadly is it can that's unfortunately a common story.
Now, Dr. Woods, do you see, because I know there are those who say, oh, it has some therapeutic uses. Do you see any possible therapeutic use for kratom?
There are very strong lobbyists to say, this is the only thing that has been effective at treating my chronic pain. And a lot of individuals will say, this is the only thing out there that, helped get me off of heroin, helped get me off of fentanyl. And so in 2016, when the FDA said they were going to put it on the controlled substances list, that proposal was withdrawn because there was very significant public and congressional backlash from scientists, from lawyers, from patients. The kratom industry, it's a multi-million dollar, and I think I even read like $1.5 billion in
Wow.
industry. So there are very strong lobbyists. 7 states have banned it. It's illegal in Washington, D.C. And then some local jurisdictions have made it illegal. Like, for example, in California, it's legal, but in San Francisco, it's illegal. There's a county in Florida, I think it's Sarasota County, where it's illegal. To the folks that say, it is treating my chronic anxiety, it is treating my chronic pain. My recommendation is let's get it regulated then, because when you are buying kratom from a gas station, you don't know what's in that. And because you don't know what's in it, then we see side effects in the emergency room. People will come in with seizures. People will come in with liver damage. You heard, Timmy's story, couldn't remember where his car was and was in the ER for 3 days. So you see people come in with these horrible side effects. There's a story of a person needed a liver transplant because of the damage it did to their liver. So I feel very strongly that at a minimum, it should be regulated, and that if individuals are using it, they need to know what they're using.
So, in your view, should it be a controlled substance?
In my view, it should be a controlled substance because I see patients coming to me saying, "Dr. Woods, I need help. Please, I need to get off of this." And every time I treat somebody who's addicted to kratom, I'll ask them, I'll say, this might seem like a silly question, but do you think kratom should be legal or illegal? And I haven't had one patient yet say that it should be legal. They've really struggled with the addiction and struggled with relapse. But I do feel it should be either a scheduled drug or at a minimum regulated. And I think that could be a happy medium if it's regulated.
If it's regulated. Timmy, what do you think about that?
Well, I was just going to ask the doctor, are there any of these alkaloids that could possibly be used in a very controlled way as a pill or something that might, under the right circumstances, help someone if it was, just a pill that had, with lots of research to find out if that might be possible.
100%. I wouldn't be surprised if 20 years from now, a doctor could write a prescription for metragenine to treat this or treat that. So maybe, these lemons could be turned into lemonade and they could study these alkaloids and all the different active ingredients. One piece of news that is new in end of July of this year, the FDA did take steps to restrict the 7-hydroxymetragenine. They also call it 7-OH. And so 7-OH is one of the active ingredients in Kratom. And so some of the gas stations are selling exclusively the 7-OH, and that's what I refer to, and others refer to it as gas station heroin. So the FDA is trying to make 7-OH a controlled substance. And I think that would be very helpful because they're these clandestine chemists are basically selling the most addictive property, bottling it up, and you can get it at a smoke shop, a gas station, and folks are becoming addicted.
I'm going to ask both of you, what advice would you give to somebody who is struggling with kratom addiction? Timmy?
It's not what it seems to be. It's not an herb. It will have, as the doctor said, it will have that where you need more and more. And I don't know how many people can just keep it within some sort of therapeutic dose, if that was what. But I don't think it really does that. I think it really has a tendency, like every other drug, you need more and more. That's my position on that. Like, I don't know whether it should be a controlled substance. It's just not in my, I don't have any expertise like the doctor does. But I'm very interested in the idea of regulation. Absolutely.
And Dr. Woods?
I would say if you're addicted to kratom, get help. There's a lot of addiction hotline resources, a lot of phone numbers. There's a lot of doctors who are trained to treat addiction. So if you're struggling with addiction, or if you're struggling with chronic pain or depression, don't seek treatment at a gas station. See a mental health expert because there are options available, and there's hope, and there's treatment, and there's recovery, and help's available. I can just tell one last story. I know of this one patient. He was taking kratom to help him focus. And then fast forward 6 months later, the focus of his life was just, how am I going to get kratom that day? His focus really revolved around that product, the kratom product. And so, but there's help out there. So if you're addicted to kratom, addiction experts, they know how to treat it. They can get you help, and you can start your path on recovery.
So do you have any specific resources that you can give our listeners where they could go for help?
Sure. So there's a lot of them out there in every state. At Northwell Health, we have a large addiction medicine program. But New York State, they have something called the Office of Addiction Services and Support. In New York City, Department of Health, they have numerous drug and alcohol services. There's heroin prevention organization in Nassau County and Long Island. There's many resources at one's fingertips, and a lot of the treatment is covered for free. A lot of the treatments that we do prescribe, we don't have to, if I'm writing a prescription for medication X, I don't need prior authorization. It's covered by Medicaid, it's covered by the insurance companies. The treatment is also not cost prohibitive.
Oh, that's really good to know. And, we have a national and indeed worldwide audience. So people should maybe contact their state health department.
100%, or talk to their primary care physician, because there are many, many resources out there.
Well, that's excellent. Well, is there anything else either of you would like to add?
Well, it sure ain't what I thought it would be. And my intentions were good. My intentions were, this might just be a natural way to get myself off of benzodiazepines. And it didn't really work out that way.
So why get yourself off of the benzodiazepines?
I'd heard they were dangerous, and I thought that I took Klonopin, and I felt that the normal dose just wasn't cutting it anymore. And I found that was even more, I guess I'm sort of asking the doctor a question. It's like, if you have a choice between these two things, both of which have detractors and people that approve of them, it's a question that I think a lot of people have.
Yeah, Timmy raises a good question. I think if somebody wants to get off of Klonopin or Xanax or whatever benzodiazepine, they should speak to their doctor, because it can be very hard. And your healthcare professional or your doctor, PA, nurse practitioner, they can come up with a plan. First, they'll ask why, and try to understand the patient's goal. But the doctor can work through a plan to slowly taper. And because if you go it alone and you transition to a product like Kratom on your own, that can have a host of side effects. But luckily there are healthcare providers that have backgrounds in doing this and can hopefully help you.
Thank you.
Well, thank you both for giving your time. And Timmy, thank you for your honesty and sharing your story. And Dr. Woods, thank you very much for sharing your expertise with us. Hopefully this will help some people who are struggling with this drug. Thanks for joining us. We'd love to hear from you, so please visit our website at nowletstalkthepodcast.com and send us your comments and questions. We'll see you next time.